So I'm doing IV push, and I'm looking at my doctor's order, looking at my MAR, and I'm looking at my patient's name, my patient's date of birth, and my patient's allergies. My doctor's order says he's ordering 20 milligrams of IV push every 8 hours. And on my book, it says that 20 milligrams over 8 hours is a safe dose. This medication may be given undiluted, and the rate, it says it can be given over 1 to 2 minutes, but I'm going to be giving it over 2 just to be on the safe side. I'm also assessing prior to giving this medication for potassium. I'm going to be monitoring closely my blood pressure and doing routine checks of my electrolytes, looking at my BUN and creatinine, looking at my INO, and checking on my CBC and liver functions. I will also let my patient know that this medication will cause an excessive will cause excessive urination, so to please call prior to ambulating. I will also let my patient know that this could cause photosensitivity, so stay away from the sun. And if she's experiencing any dizziness, weakness, nausea, to please let me know, or short of breath, itching, or hives. So I'm looking at my fluid that is infusing, and this is 5W. And looking at my looking at my book, this fluid is compatible. Okay, so I am getting ready to prepare my medication, but first I need to check my medicine against my MAR. So there's no cracks. I'm checking for expiration date, August 2021. This is fine. And furosemide, this is exactly what my doctor ordered. So I'm getting ready to go in my room, getting ready to set up my syringe and needle. Okay, so I will grab this. First, I'm gonna wash my hands. Okay, I'm cleaning my vial for 30 seconds. Okay, letting it dry for 30. And I'm opening up my syringe and my needle, going straight in. Okay, and I'm pulling on air. I worked out my math problems, and what I'm going to be administering is 2 mLs of furosemide via IV push. So putting 2 mLs of air into my vial. And I'm pulling back 2. Okay. Okay. Oh, there's a little bubble in there. All right. Okay. Sweeping method. And I'm going to do my label. So what I'm going to fill in is my patient's name, Miss Jones, drug, furosemide, the amount, 2 mLs, the date, the time, my initials, the expiration date, and the time. And I'm going to be putting it on the syringe to get it ready to take into my patient's room. Okay, so I have my MAR with me, and I'm going in my patient's room, but before I do that, I'm going to wash my hands. Okay, washing my hands. And I'm going to introduce myself to my patient. Hello, my name is Genesis, and I'm going to be your nurse today. I'm going to be administering furosemide. Can you please state your name and date of birth? Okay. Do you have any allergies? No? Okay, well, this medication is going to go into your IV port, and it's gonna help with all that swelling and extra fluid that you have. It will cause you to feel like you have to constantly urinate, but please call prior to ambulating. It will also may cause photosensitivity, so please stay away from the sun. And please let me know if you start experiencing any shortness of breath or itching, hives, anything like that. Okay, so before I administer, I'm looking at my IV site. There's no swelling, no redness, and I'm looking at my bandage is dry and intact. So I need to check for patency. And I will grab my IV fluid and put it below my arm. And I see good blood return. Okay, getting ready to administer. And I will get the port closest to my patient. And I need to clean it for 30 seconds. Okay. And I'm going to be administering this, like I said, over 2 minutes. So I'm going to do 1 ml every minute. And I will connect this to my port and clamp on the line closest to my bag. So I'm gonna push this clamp, gonna push 1 ml and on clamp and wait him for a whole minute. While I'm doing this, I'm observing my patient, making sure they're tolerating it well. There's no burning or stinging feeling, no infiltration, no symptoms of like an allergic reaction. Okay, 1 minute. I'm gonna pinch again and give the remaining 1 ml. Unclamp. I'm waiting a whole minute. Okay, so I will discard and dispose of all of my trash, put it in the sharps, and I will talk to my patient again, make sure she's doing okay, she tolerated it well, and I will make sure she doesn't have any needs or that she doesn't she's not feeling bad, and I will document my medication, my route, my dose, my rate, and my patient's response, and my signature, and that's it.